You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Michael Gorton, who is the founder and CEO of Recuro Health. He is also, more notably, as the founding CEO of Teladoc. Welcome to the show, Michael.
Thanks, Dr. Roxy.
It is so nice to have you here. I like to start off every episode with having my guests just tell a little bit about your background and what you're innovating these days.
Well, I like to live in a world of adventure and entrepreneurism. So you put those two together and the world is your oyster. And so, we've done everything from telemedicine to record labels, to book publishing. But right now, we're back doing the telemedicine and innovating healthcare.
Awesome. So that's like, it's explosion of innovation happening right now. Lots of exciting things happening.
It is.
So tell me a little bit more about what you're innovating, in the near future.
Well, so let me run the clock back a little bit to the early days of telemedicine. When we started Teladoc, the resistance wasn't, can we innovate? Can we find new ways of delivering physicians to patients? It was the regulatory bodies that said, if you build this, you will go to prison. And that struck fear in the hearts of many. But for the adventurer entrepreneur, it's like, okay, how can we fix this?
Yeah.
So that's what we did. That's what we did in the early days. And essentially what we ended up with was an engine that delivers doctors to patients pretty quickly. So let me sort of trace that for just a second. Pre-Teladoc, I want to talk to a doctor. I pick up the phone, I call the admin at the doctor's office, that we compare calendars, and next Thursday at 8 a.m., we now have an appointment. That's a few days from now. So, I let my boss know I'm going to be missing half a day. That was the old model. Yep. The new model, post Teladoc, is I log on to an app, I punch a couple buttons, and a doctor calls me back in 8 minutes. And I'm angry if that doctor doesn't call me within the hour, right? Something's wrong. The system's broken. And so what we did was we changed the efficiency paradigm in delivery, but we didn't change the kind of care we're getting. And so what I mean by that is, I'm sick. I need to talk to a doctor. Mm-hmm. Pre-Teladoc, it was wait till next Thursday, come in at 8 a.m. Post-Teladoc, it's doctor calls me back in 8 minutes. But the problem still is I'm sick. Is there a way to use this engine that we've created to try and catch things before I become sick? Mm-hmm. And with all of the digital tools we have, if you're wearing an Apple Watch, we're collecting all this data and it's going nowhere. But if we could take the data and push it somewhere where it can be analyzed, then we can start catching things before they get expensive and dangerous.
So that's really interesting. The wellness and prevention market has kind of been happening for years now on the fringes. So what is happening in the macro or micro trends that make it the right time for that type of transformation?
Yeah. Well, I think about the early days of wellness. I mean, it was a clever idea, but we all joke around jumping jacks in the parking lot and eating bran muffins at work. That was wellness in the beginning. Yeah. And so, is what we are doing wellness? Essentially, yes, but we don't like the word because it creates an image in people's mind that isn't correct anymore. Yeah. We're really using biotechnology and remote patient monitoring and real tools, genomics. 2-3 years ago, genomics was crazy expensive, but now we can do it pretty inexpensively. Mm-hmm. We can use it as a tool for knowing the individual rather than the masses. And so we can point a laser on you, Dr. Roxy, and say, you have a family history of these things, and we're going to watch for them. And then what are the other tools that we can stack on top of that? So
that's very revolutionary right now, somewhat similar to how revolutionary it was, years ago when you were bringing the Teladoc idea to market. What was it like then? And what are some of those lessons learned that maybe you're doing differently, or maybe even like it worked, I'm doing the exact same thing in both businesses?
Well, I think the main thing is we're not going to fight a regulatory battle. Every entrepreneur listening to your show will recognize the investors of the world always ask us, what keeps you up at night? And I started this podcast by saying, I'm an adventure entrepreneur. And I hated that question because nothing kept me up at night until I went to a board of medical examiners who has their own court system and their own judges. And they said, if you build this, you will go to prison. Well, that kept me up a few nights. and so, that battle is the one we had to figure out. And I call it battle. I should be really careful about this because we never brought lawyers, guns, and money to the boards of medical examiners. We always tried to bring thought leadership.
Sure.
Don't bring a lawyer, bring a surgeon general. And then you're collaborating rather than fighting. And so I think, that's the thing that we needed to solve back then. Now the thing we need to recognize is that our whole healthcare system is designed around treating you when you become sick. So there's a little bit of changing the thinking about all of this. At the same time, we're creating the technology to make the change.
So one of the barriers that I've always heard from a payer standpoint, from a payer lens around prevention is, consumers are changing health insurance companies every couple of years on average. And so I hate to say it, but I'm just going to say it. Am I, as a payer, going to reap the benefits of paying for all these prevention services if they're not even going to be part of my member network in a couple of years?
Yeah. So, and see, that's the exact wrong thinking. Now we're thinking about the capitalist side of it when we ask a question like that, and we should still be thinking about that. But the reality is, if we can keep people healthy, then the cost for everybody will go down.
Yeah.
And, we all know somebody who wasn't feeling well, kept playing with their spouse and children, and finally made it to the doctor and got the stage 4 cancer diagnosis.
Yeah.
The reality is that's a very expensive. I mean, we're talking millions of dollars in some cases. Definitely going to change the life of the person and maybe even end the life of that person. And so the repercussions of that are pretty big. But we also have to remember that, the economics of it are such that we can't send a test to everybody every few months. We've got to find more efficient ways. And we've got to find not just efficient from a dollar perspective, but from a simplicity perspective. Because that example I just gave you, somebody who waits. Why did they wait? Because it's difficult. I've got to call. I've got to go in somewhere and get tests done. And can we simplify that? And the answer is yes. That's one of the things that we're working on right now, simplifying it.
So one of the things that comes to mind is, when my body is going off with those alarms, that sometimes it's easy for me to ignore, and unless the house is on fire, right? And unless it's really debilitating.
Yeah.
What I hear from you is, with remote patient monitoring, with wearables, with all of these quantifiable measures or maybe continuous quantitative data loops, that type of data could potentially motivate us to take different action as opposed to just ignoring it.
Right. And so just recently published a book with the father of telemedicine, Jay Sanders. And we start the book with a case study in the very beginning of Teladoc that was meaningful to me. And it's a patient who wakes up, something's wrong with him. His wife says, you need to go to the doctor. And he says, no, I'm busy. And what ends up happening is he's driving to this very busy meeting of his, or very important meeting. And he thinks, wow, I've got this new thing called Teladoc. This is way back in the beginning in 2003 or two. So he makes the phone call and the doctor says, go straight to the emergency room. So wife says, go see your doctor. He's like, no, I'm too busy. But when doctor says it, he stops what he's doing and he goes, and it saves his life. And so you think about, where are we getting our information? If it comes straight from the doctor, then we're willing to abide by it.
Yeah, that makes sense. Otherwise, we're just second guessing. Is it really that big of a deal? Yeah.
Yep. And my favorite analogy that most people have heard me say over and over again is, when was the last time you ran out of gas in your car? You don't do it because you have a fuel gauge.
Right.
When that thing is getting over to the left side of the towards the E, it's time to go fill up. And we don't have one of those here. And so we're constantly guessing because, after you get past 35 years old, you have pain all the time. You just ignore it. It's just another day, right?
It is. And, once you're experiencing it for any, period of time, you're just kind of numb to it. It creates a new normal for you. And, I've had that experience multiple times, and it's really not until I have some type of intervention, then I can look back in hindsight and going, gosh, I was really in a lot more pain than I realized. Or, whatever that might be. We just become numb to it.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
So you mentioned simplicity. And we talked before about, what's your number one commercialization strategy for bringing an innovation to market successfully. Tell us what you mean about simplicity and how that fits into the lens of a commercialization decision-making.
So perfect timing. I just used the fuel gauge because that's simplicity, right? Yep. And so we have to recognize, those of us who are in healthcare have to recognize that our customers, if you will, are musicians and engineers and athletes and, housewives, house husbands, children. They don't know about healthcare, and we're not going to educate them on it. So we have to be on the front end. We have to be that gauge. How can we do it? Well, the answer is 20 years ago, we couldn't. We did not have the technology we have today. But today we have genomics that you can get a panel done for $100. It's an investment well worth taking because it lets us know what your proclivities are, what are your genetic issues that we need to be on the lookout for, and then once you know those, then you can start monitoring for signs that they're progressing, and when they do, catch it early. It's like the doctor always tells us, if you catch cancer at stage 1, it's easy. When it's stage 4, not so good. And I'm just using it. We're not just talking about cancer. We're talking about everything. But I use cancer because everybody knows somebody who's had a stage 4 diagnosis.
So is it simplicity in the business model? Is it simplicity in the messaging, the features and functionality, all of the above?
Yeah. So it's kind of all of the above, but what's happening with that fuel gauge? Think about it. There's a tank behind you, it's flowing fuel into an engine, and something's got to figure out where it is, sending it a piece of information to a gauge. And we have to put all of those components together. So simplicity in some cases is we're looking for signs. Well, where do we get those signs? We have to be very careful because most of us were raised having read George Orwell's book, and we don't need a big brother, so to speak, constantly looking out for us. But many people have a watch that captures all kinds of data all the time. And where's that data going? Mostly nowhere. And some people even have like a mattress that captures data. I have this really great scale that I stand on every morning for 30 seconds. And I had no idea before I bought this thing that it could tell me, well, visceral fat and water content in my body and how much I weigh, but bone density, body mass index, all these things that it captures. I think there's like 16 data points that standing on the scale for 30 seconds captures. And so where's all that data going? I look at it, I walk away from it. But it communicates with my smartphone, and my smartphone should communicate with my medical record. And that 30-second time investment in the morning every day could be sent to a medical record that's looking for trends. And from a simplicity perspective, the simplicity could be on the patient side or the doctor side. So let me paint the doctor picture. You go to the doctor, we've all done this. They put a cuff on our arm, pump it up, and they say, your blood pressure is 120/70, you're good. That is a static data point. That doctor does not know what it was this morning, yesterday, last week, last month, last year. And there could be a trend that you can't see from one data point. So we can start capturing things from the devices in our house. And now you go see the doctor, and it could be in a Zoom call like we're in right now. And the doctor looks at a graph and it says, okay, your body temperature every day at 8 a.m. was this, your pulse rate was this, your blood pressure was this, your EKG looked like that. So now it's not a single data point, but it's like, what's it been doing over the last 3 days, 6 weeks, and all of those things are super valuable to the doctor. And if it was just a chart with the numbers, not so simple. So our medical record needs to be able to paint beautiful graphs with lines and colors and things that the doctor can immediately look at and go, oh, look at this. I see a trend here, and it's not a good one. Or I see a trend here. This is a good one. You're losing weight. Your numbers are getting better. So those things are valuable, and their simplicity. And those same graphs that the doctor will use from a much higher level, the patient can also use and say, I'm doing pretty well. I'm losing weight. My body mass index is changing positively. The visceral fat is going down. And so these are the things that I think represent simplicity on the front end of diagnosis.
Which is so interesting because it's a very complex problem that you're discussing of solving in a very simple way. Right. So how far are we away from that? I mean, is that just like, dreamland and, in 3 years we might be there? How close are we to getting to that moment?
We're doing much of it right now at my company, and we're adding new things all the time. I mean, this whole thing about turning the medical record into something absolutely dynamic is something that we're working on today, and I'd like to have done this year. The other thing that I want to have is when I say, okay, you can capture data from my Apple Watch and from the scale that I use and from other devices, that data should be flowing into a medical record that is constantly monitoring. So I'm going to go back to the car analogy. You're driving down the road and a check engine light comes on. Well, I don't really know what it is, but there's a device I can plug in and look at my smartphone, and it says my spark plugs are bad, or fuel line is whatever. So those kinds of things we can capture when we see data flowing in. There's a trend line. Nobody's looking at it, but we can have AI in our digital medical home, our medical record, constantly watching the data that comes in. And if it sees a trend, it sends that check engine light to you, the patient, and to your physician. And you can both look at it and say, what do I need to do with this?
A lot more valuable push notifications than, let's say, how many viewers on my TikTok video, or how many new friends I have that accepted my friend request on Instagram.
Yeah, exactly.
So I know that, there's tons of people in our audience that are just going to be really excited to hear this conversation and hear a lot of the wisdom of your experience as a serial entrepreneur. So I want to ask a few questions that I think that they would want to know answers to from your perspective.
Sure.
How do you find the white space?
You have to be constantly looking. The chairman of my board tells this story about lucky people and unlucky people. And without going into great detail, there is a difference.
Okay.
And there's what in the case study that was done on lucky and unlucky people, two groups of 100 people, 100 that were lucky, 100 that weren't, were given a newspaper. And the project was count the number of pictures in the newspaper. And if you get it right, you get $100.
Okay.
The unlucky people, almost to a T, counted the right number. But on the second page of that newspaper was an article that said, mention this headline, and you get a second $100. 100% of the lucky people got the right number of pictures, and they said, oh, by the way, on the second page. And so why is it? Why did the unlucky people not mention it? And the follow-up on them said, I didn't see it. You gave me one assignment. That's what I did. Some of them said, yeah, I saw it and I thought it was a trick. And so if you think about that, lucky people are the ones who are constantly looking around. What else is here? What else can I do? What can I learn from the room that I'm in right now? And unlucky people don't do it. They do their jobs really well, but they're not looking around for the white space.
Beautiful, beautiful. So another thing that I want to ask you is, so I was listening to this video of Jeff Bezos not too long ago, who was talking about, he's walking down the street and people are commenting on, let's say, a press release that came out or some type of new earnings report and giving him compliments. And he's trying to think of like, what are they even really talking about? Because what he's working on right now are the things that are going to be rolled out in 3 years from now. Mm-hmm. And he talks about how CEOs of companies, if you're working on what's happening today, your business is going to be in trouble. If you're working on what's in, 6 months or even a year from now, you're in trouble. It's got, kind of that Wayne Gretzky quote, right? Is like skate to where the puck is going. Right. So I think about you in this example as well of, the tenure that you had with Teladoc and the decision that you made to move and kind of think about where the industry was going in 3 years instead of just focusing on where the industry was in that moment. Share a little bit about that story.
Well, so I think that a successful company has to do both. Bezos' job is to stay ahead and figure out where that puck is going to be going. But his company is not going to be successful if he doesn't have people that are also doing the day-to-day. Yeah. And, we constantly are looking at that in my company. How do we make sure that the day-to-day things are happening at the same time? Everybody recognizes, here's the vision. And we've got to always be skating towards that vision at the same time that we're making everybody happy today.
And I think actually most organizations really struggle with that. They either lean towards one or the other. Right. They're, Kodak and Blockbuster, right? The typical really focused on today and not enough on where the puck is going. And then you've got some that are just continuously focused on where the puck is going because they're just visionaries and they aren't surrounding themselves with other people that are gifted in that operational efficiency and in quarterly earnings. Yeah. So you left Teladoc when it was successful. What was the motivator or driver of that transition?
So, the early stages of Teladoc, we had a couple of problems. We had to demonstrate the efficacy, but we also had to show the bureaucrats that this was a viable path. And I'm constantly telling people that whole question about what keeps you up at night. In the early days of Teladoc, I remember investors saying to me, yeah, if it was such a great idea, United Health or one of the big players would do that. And to me, that's funny. What do you think the CEO of United Health would do if he walked into the board of medical examiners and they said, you build this, you'll go to prison? Would he have built it? No.
No.
So there's a place for entrepreneurs, and that is, we have to be the risk takers. We have to be the ones who say, no matter what happens, we're going to figure out a way to solve this problem.
Yep, I love that. So what are some of your proudest moments in your career?
Yeah. Well, I remember celebrating our 1,000th member at Teladoc. And we did that in the U.S. Capitol building. We had 2 U.S. senators from both sides of the political aisle, 2 former HHS secretaries. And you have to think, okay, here we are. 5 years earlier, I was in a board of medical examiners where they said I was going to go to prison. So I'm standing there thinking, wow, 1 million members. We're delivering doctors to patients in less than an hour. Everybody's happy, except there were still 17 boards that were after us. And so on one side, I was thinking, I'm under the Capitol Rotunda. This is so cool. And on the other hand, when I leave here, I've got to figure out how to make these guys happy. So, I love that. As an adventurer, getting to the top of Kilimanjaro, a really hard task. It's a giant mountain. I mean, the Kilimanjaro is a third of the size of Colorado. It's a mile higher than the tallest mountain in Colorado. And so it's quite the trek. And,
is it a more difficult mountain to peak or summit than healthcare?
Well, they're in a way they're related. I think John Kennedy said it best in his moon speech. He said, "We choose to do these things not because they're easy, but because they're hard." And that's why we do these things.
So this is my Kilimanjaro. I'm training for the Savage race that's happening in about 4 or 5 weeks.
Yeah.
So
oh my gosh.
It's not going to be easy. I might not even be able to finish a lot of those obstacles, but that's my Kilimanjaro here in the
awesome. Just whatever happens, keep going.
Yeah, exactly. Yep. Have fun along the way. So as we wrap up here, Michael, what are just some of the lessons learned thinking about folks in our audience, are, health systems that are entrepreneurs, innovators that are all phases. Some of them have an idea and a dream, and others are, trying to scale their businesses. What are some of the lessons learned that you want to share with them before we wrap up?
Sure. First of all, remember, it's not the idea, it's the work that you put into making it happen. You can say, I want to climb Kilimanjaro all day. You can fly to Africa, but if you haven't done the training, you're not going to make the summit. And so you have to think about that. You have to do the work. And then it's not going to be easy. You're going to get knocked down and kicked in the teeth a lot. So the way you respond to it is you get up, you put a smile on, you go, what did I do wrong? Let's go again. And then the last thing, remember my little story about luck. Every room you walk into, don't just go there to say happy birthday to somebody. Go there to find out what's in that room. There are great things there. Find that headline that says, if you mention this headline, you'll get the second $100.
That is fantastic. So how do folks get a hold of you to find out more about Recuro Health?
Yeah, so LinkedIn is the best way to reach me. 15 years ago, it was a pretty weak tool. Now it's fantastic. It is really such a great business tool for finding people that are like-minded and in the same space and willing to help.
Well, that's how we met.
We did. So there we go.
There you go. Well, thank you so much for joining me today. I appreciate it.
Yeah, my pleasure.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.